about my problems. I was informed that the pain I have is stage 3 pressure ulcer on my buttocks and a wheelchair back. How in the world am I supposed to stay up?
It was awful. It gets depressing, and occasionally I feel like giving up, like it will never heal.
Pressure ulcer can be very serious. It's a significant source of pain and distress for patients who develop it.
I couldn't believe it when I saw it. It's a nightmare.
I can only imagine how frustrated the patients are. Healing is a slow process, especially if they have contributing medical problems.
Pressure ulcer is defined as localized injury to the skin or underlying tissue, usually over a bony prominence as a result of pressure or pressure in combination with shear. Any patients with impaired mobility or sensation, such as the elderly, stroke victims, patients with diabetes, people in wheelchairs or who are bedridden, are at higher risk of developing pressure ulcer. When an ulcer occurs, documentation of each ulcer and appropriate staging are essential to wound assessment. Prompt detection and treatment of pressure ulcers on admission can help reduce the incidence of hospital-acquired pressure ulcers. Patient came in for admission. Before she is taken to her room, admitting procedures are performed. Her personal data is recorded and entered into the hospital's computer system. Once taken to a room, the nurse that will take care of the patient will go over the medical and medication history and orient the person to the room. Since hands are the most common vehicle for transmitting infections, it is essential that all staff who came in contact with patients understand the importance of good hand washing practices. The purpose of recording vital signs is to establish a baseline on admission to the hospital. All patients should be reassured that recording vital signs is a normal part of health checks and that it is necessary to ensure that the state of their health is being monitored correctly. Before going any further, nurse must be sure to introduce herself, identify the patient, and explain the procedure. Make the environment conducive to assessment, like turning on lights, donning gloves, and protect privacy as much as possible. Now, nurse examines each part of the patient's body, starting at the head and moving down. Nurse also examines patient's back, looking closely on bony prominences. After the physical assessment is completed, the nurse will complete the Braden Scale Skin Risk Assessment to determine patient's risk to pressure ulcer. Braden score helps a nurse assess the patient's risk of developing pressure ulcer by examining the 6 categories: sensory perception, activity, nutrition, mobility, moisture, and friction and shear. Each category is rated on a scale of 1 to 4, except the friction and shear category, which is on a scale of 1 to 3. This comes out to be a total of 23 points. The higher the score, the less likely the patient is to develop a pressure ulcer. If a patient has a score of 18 or less, it indicates increased risk of pressure ulcer development. Thus, prevention activities are implemented, such as repositioning the patient every 2 hours, using specialty bed surfaces as needed, and providing optimal nutrition. Wound management involves a comprehensive care plan with consideration of all factors contributing to and affecting the wound and the patient. No single discipline can meet all the needs of a patient with a wound. The best outcomes are generated by dedicated and well-educated personnel from multiple disciplines working together for the common goal of holistic patient care. Handover is such a delicate thing in the process of the nurse's day. It is vital to know what the patient has been doing the previous 12 hours. Education of patient, families, caregiver, and healthcare providers is the key to a proactive program of prevention and timely appropriate interventions.
Here in Sultan bin Abdulaziz Humanitarian City, we believe that prevention is far easier than treatment. We in Women's Health Group joins the celebration of International Stop Pressure Ulcer.